Finding breast cancer at its earliest stage increases patient survival rates and is the goal of mammography. Mammographers must capture the most amount of breast tissue possible in order to visualize posterior breast tumors. In a study of cancers observed in women at high risk, 67% of the breast cancers were in the posterior or immediately pre-pectoral location. Another study measured images using Bella blankets, compared to the prior year, where no protective coverlet was used. 48% of patients showed improved visualization of the pectoralis muscle. Visualization of the IMF as open improved from 67% to 87%. And visualization of retroglandular tissue increased from 86% in the prior year to 96% when Bella blankets were used. On 77% of patients, more tissue was acquired using Bella blankets. If the smallest detectable breast cancer visible on a mammogram is 0.2 to 0.3 centimeters, imagine what you could find by getting more breast tissue on 77% of your patients. How many more cancers might you find with the use of Bella blankets? Every millimeter counts. To order, call 1-800-233-5539 or visit Beekley.com today.